Good afternoon. My name is Schain Irion. I'm going to take this opportunity to just discuss some of the research um, that I provided and went through during the course of my practicum with Liberty University. It's a great opportunity, and I really appreciate the opportunity to just discuss some of the pieces that I had. And the focus of my research was really to look at the health disparities of India and how do we bridge the gap to that care utilizing some key technologies that have been developed over the course of time, and they're really being implemented throughout different systems and different hospitals as well as different countries to engage the care. So as we begin to walk through our slides in this PowerPoint, let's start really off of on slide number 2, where just a breakdown of why India and health disparity. There's several kind of key areas. India is a developing country. They have some very unique class barriers, which digs into and starts to create this understanding of what does that mean for society as a whole. There's also some governmental distrust that has been built up and occurred within not only healthcare, but also the community. The fourth really is looking at poorly managed healthcare, and how does that impact the overall care for the community as well as individuals. And then the fifth is just kind of the financial barriers to quality of care. And this quality and this financial barrier is also linked back to that second bullet of class and societal visibility to key areas of individuals that are in different rural areas, different villages that may not have the means to access private health care. So these are just 5 areas to think about from the beginning of this process. Let's shift over to slide number 3. Slide number 3 is really an understanding, and it gives us a historical perspective of research and health focus throughout care. 3 of the big areas that we're looking at in 1990 through 2000 is maternal health, child health, and overall mortality. There's a couple other areas that start to get teased out that are kind of on the back end. There's not as much focus being contributed to these. So what you're seeing in these different pie charts is the impact of public health or healthcare focus for the country of India. Some of the other key areas from 1990 through 2000 to really think about is risk factors as well as medical services. And as we keep those 2 areas in mind, as we shift over to 2001 through 2016, we see child health is still high. We look at maternal health as still a focus. But now we're starting to see an increased impact of looking at risk factors and health services. Mortality has really taken a shift in it because there's a realization as we start to think about research that the risk factors and those preventative areas are actually leading towards increased mortality rate. So what this is showing us is that knowledge and information is being shared and research is being created to begin shifting the focus for healthcare, the focus for public health to be engaged in the overall care. So this really just starts to lay the groundwork for how we're looking at this research. So now let's look at slide 4. Slide 4 is really talking about the health burdens. And the research for this program was set out to look at what are some of the big areas of health that are impacting the country of India. And like many countries, diabetes, hypertension, many of those chronic diseases that are based off of poor health, poor education, poor understanding, poor knowledge, and poor diet, all are revealed during the course of the research. But like many developing countries, there's a burden to provide quality health care for the people of the country. And there's 2 different routes that have been taken. The government is trying to impose their focus and their engagement on healthcare. And then there's the private sector. The private sector, when we're going through research, historically has a higher impact and better outcomes for the patients than the governmental impact. What you're also seeing on these two pictures are the urban impact as well as the rural. And so now we're creating a dichotomy to start thinking about, when we think through the public health approach, which areas have access and what does that access look like. The rural community has a challenge to even engage and see a healthcare professional, while the urban environment may have access to it. But if they don't have the financial means, they are left with a subpar governmental option. I think one of the key areas too, as we start thinking through and looking at the research, is the barriers. As we've mentioned, we really talked about class and the structure, this structure of societal structure that's been established, historical establishment, has created financial barriers which really hinder the access to private health care for many in India. The rural villages, for those, as we can see, have little quality of care for the community. Most of what they're seeing is individuals that are just trying to make it through, so their mortality rate's higher. They get impacted with some of those preventative diseases, diabetes, hypertension, because of diet. Had they known previously, because of education or access to, those pieces may not have been as impactful. The other one of the barriers is medical specialists require travel and financial capacity for many of the individuals in these communities. The research really broke down the ability to understand how impactful that is and what are some of those key areas. And some of the key areas is simply financially. They don't have the ability to travel many hours for medical specialists, even if they had a primary specialist in that community. The other big piece to really think about when we're looking through this research and really thinking about this project was value of life. The value of life in India is very different, and a lot of this is based off of an overall understanding of some of their spiritual and religious beliefs, of looking at the impact and what happens with eternity. So that really plays into a part of looking at the research through the lens of value and value of life for the community. Slide 6 really just kind of starts to break down some of the health focus that we want to really think about and think through for this for the overall project. And the health focus was to identify some of the key impact areas, some of the key disparities. And disparity, we're talking about access. Are there primary care providers in those communities? If there's not, that's a disparity that needs to be corrected. And how do we engage that? And that is my overall practicum, was working with an organization called StatSave, and they have identified a key area that can work through some of those pieces that we're seeing from primary care epidemiology that we see in this overall table, saying these are some of the key areas. One of the other impacts is looking at we really reviewed some of the previous research on how we would approach key areas in the community. And then we looked at designing a future approach to this. So I want to shift over to slide 7 and just really talk about StatSave. StatSave has created mobile units that go into rural villages of northern India. And prior to COVID-19, they were in those villages. Unfortunately, our research was impacted by the fact that we didn't have access because COVID shut down the ability to get in there. But they're really looking at medical providers, nurses, and technology utilizing telemedicine as a source to bridge that gap. So what we're really seeing on 7 is really that comprehensive 360-degree view. I think finally on slide 8 is really some of the research outcomes and conclusions. The research was drastically impacted, and because of the villages and the limited access due to COVID-19, we were hoping to improve some of the access recognitions by utilizing telemedicine. However, that was limited. Also, our conclusion is we're recognizing that telemedicine and those technologies improve access, and that improved access supports better outcomes for the community. Overall, we would like to continue to drive in and get more research and more understanding for the villages and how this truly impacts. So I'm looking forward to the next outcome and final research as we move forward. Thank you.